Hi guys, welcome back to my channel, and you know it's a girl to package, and I'm back with another exciting video. Guys, before we move on to today's video, don't forget to subscribe to my channel if you haven't yet subscribed. So in today's video, I'm just going to give you a brief history about what happens at the emergency unit. So I'm going to take you through the activities, yes, for you to be aware of everything that happens there. Don't forget to stay tuned, and don't forget to like, comment and subscribe. So if it is your first time entering the accident and emergency unit, you are first taken to the triage area. Yes, that's where we take your bio data, like your data, what happened to you, the reason why you're in the hospital. We take your name, your age and a whole lot, just like this one. That's what happens at the triage area. And mostly they ask you when it started, maybe so stomach pains, when it started, for them to know how your treatment is going to be. So the second thing is, at the emergency unit, we have a resuscitation area. Yes, we mostly call it R. So maybe R1, that's a resuscitation area 1 for the first bed. So it has like 5 bed capacity. Yes, so at the resuscitation area, mostly patients do not lie there for a long time. They usually put patients who needs close monitoring and who needs attention. So patients with serious or severe conditions are placed at the resuscitation area. So if any patient becomes stable or gets better gradually, the patient is either moved to the male ward or the female ward. Yes, at emergency, we have the male ward and the female ward. So emergency is like a hospital on its own because it's the only ward which has both the male and female ward. And with emergency, one thing about emergency is that whether male or female ward, it doesn't really actually matter. Yes, because if the number of males admitted that day exceeds the bed capacity they have, the male can equally be transferred to the female ward, still our emergency. And if it is the females that are admitted more than the bed capacity, they can be transferred to the male ward. That's it for emergency. So emergency has a male ward, and with the male ward too, it has a washroom for the male ward. So emergency also has a good setting. The female ward too, it also has its washroom, yes, for the female ward. And with the resuscitation area, it also has its washroom. So emergency is very big because cases that comes within a day, it's uncountable. We also have the nurses station, and the nurses station is situated closer to the resuscitation area because the resuscitation area, like I said, the nurses have to keep close monitoring to search people on the resuscitation area. And with emergency, we also have the theater. Yes, emergency has its own theater. And with the theater, we have machines like the scan machines, we have the defibrillator, we have x-ray machine, and we have a whole lot of machines. So with the theater, it also has type of sutures like the iron sutures and surgical blades. We also have the disposable aprons. We also have gloves, sterile gloves, and we have a whole lot at the theater. And one thing about emergency is that they can also operate in cases of emergency. That's why there's a theater there. And we also have restroom that is equally like the doctor's office. Yes, with emergency, there's nothing like maybe a doctor going around. The doctor has his office right at the ward. Yes, so in case of emergency, there's nothing like you going to call the doctor, so you have to wait for the doctor and all other inconveniences. But we have the doctor specifically for that ward, that's the emergency ward. So in case of any emergency, the doctor is called and he or she comes, depending on who is on duty that day. So with the emergency, there's no need for screens. Yes, there's no need for screens when you are in the male ward or the female ward. Screen is only used when you are in the resuscitation area because there are curtains available in both the male ward and the female ward. And we also, there's no need for any oxygen or any movable oxygen cylinder because the cylinder is just situated in the walls of each bed. So no need for pushing the oxygen cylinder around. No, it's only that if the patient is being transferred out to the female ward and male ward for the hospital, not the female ward and male ward in the emergency unit. So that's what is about. That's all about the emergency oxygen cylinders. So with emergency, we also have different types of test tubes used. We have the mauve test tube, we have the blue test tube, we have the red test tube, and the yellow test tubes. So with the mauve test tube, it's used for the normal blood sample taking, then it's sent to the lab. So with the yellow test tube, it's used for chemistry procedures, and with the red test tube, it's used for checking clotting time. So the red and the blue test tubes are used for checking the clotting time. So it is mostly used in cases of snake bites and other situations, but mostly snake bites. Because working at emergency, I saw snake bite cases, a lot of snake bite cases. So when the person comes, maybe with a complaint of snake bites, the blood sample of that person is taken and it is placed into the red test tubes. The blood sample of the person is also put into the mauve test tube. That one is sent to the lab. So with the red test tube, the blood sample of the person is taken. Then you actually check the clotting time. The normal clotting time of blood, it's less than 15 minutes or maybe up to 15 minutes. So if it is less than 15 minutes or it is up to 15 minutes, it means the person has the normal clotting time. But if it is more than 15 minutes, it means there is danger somewhere. Yes. So with emergency, I also saw cases like PID cases that brought in dead. A patient was brought in dead, and one thing about that patient was that none of her relatives knew she was actually dead. Guys, when I got to work that day, I was for afternoon shift. So this morning, staff were just checking the vital signs of this patient. None of them knew the patient was actually dead because nothing showed this patient was dead. So there was one doctor who just walked in and just looked at how the patient was positioned and how the patient was actually behaving and said, why are you guys wasting your time on this patient? The patient is already dead. But if not for that doctor, I didn't know what the morning staff would do. None of them knew there was such a case. So another encounter at the emergency is this patient came with a complaint of the lower lip bitten off. He actually got into a fight with the big brother, and his big brother bit his lower lips off. Guys, I was just shocked, and they forgot to bring the lower lip, so we couldn't suture. And we had to leave it there and treat it as a normal wound. We had to leave it just like that and treat his wound for him. So another encounter was with this patient who came with a complaint of hernia. And guys, according to the assessment and everything, the scan and everything, this patient actually had his intestine fall off into his scrotum. And guys, I was shocked when I saw his hernia. And I asked the doctor if only this intestine could actually cause the hernia. But he was like, blood can also accumulate there and cause hernia. A whole lot of things are involved when it comes to hernia cases. One thing about emergency is that the medications given to the patient are not kept at the nurses' stations, unlike other wards in the hospital. The medication this time around is given to the patient, so it's kept on the patient's cabinet. So when it's time for you to administer the medication, you actually move to the patient's bedside and administer the medication to the patient. So with emergency theater, it has a 5-bed capacity. So in that emergency, you also have the fluids room, just like other wards. But emergency, as compared to other wards, emergency is far different than these other wards. And I also had an encounter with a patient who had hernia. It's actually a female patient who had hernia and also had fibroid. So guys, this patient was complaining of feeling heaviness at her abdominal region. So the doctor came through with his assessment, and upon his assessment, he found out that the patient had hernia and fibroid. Guys, at first I thought she was pregnant, but with the scan and everything that went on that day, I found out that the patient was actually suffering from a disease, which was this hernia and the fibroid. Guys, I also had another encounter with this boy who had a dog bite. The child was actually in uniform, which means the dog bit him in school. And guys, you could see his bone. Guys, I felt pity for this little boy because he was in school and this incident happened to him. So imagine if he hadn't gone to school that day. He would have been free. And guys, one thing about emergency that other wards will never do is that during handing over and taking up, the staffs taking over would write whatever they will do or their plan for patients who have been admitted. So the nurses taking up would actually write on paper their plan for patients who have been admitted. And guys, other wards will never do this. So with emergency there is discipline, because other wards will never do this. Yes, other wards will never do this. Guys, this brings us to the end of today's video. Thank you for staying tuned up to this point. Guys, don't forget to subscribe if you're new here. Don't forget to like. Don't forget to comment what you are thinking. It's a bye for now.